Did you know that being underweight could actually put you at a higher risk of dying from cancer compared to being overweight? It's a surprising fact that not many people talk about. Today, we're going to dive into why that is and what it means for cancer patients. If you or a loved one are dealing with cancer or just want to understand this connection better, stay tuned.
Let's start with one of the biggest reasons underweight people struggle more when dealing with cancer malnutrition. Cancer treatments, like chemotherapy and radiation, put an enormous strain on the body. They can make patients lose their appetite or cause nausea and digestive issues that make it hard to absorb nutrients. This leads to what's called cancer cachexia, a condition where the body starts wasting away, burning through fat and muscle because it's not getting enough nutrition. Underweight people already have less fat and muscle to rely on, so when they start losing even more during treatment, it can quickly lead to severe malnutrition. Without enough energy reserves, their bodies can't fight the cancer or recover from the treatments effectively, and this is a huge part of why cancer can be more deadly for underweight patients. Another critical factor is muscle mass. Now, muscle isn't just about strength. It's also an important reserve of energy that the body can draw on during times of illness. For cancer patients, especially those undergoing treatments like chemotherapy, muscle mass plays a huge role in how well they cope. When someone is underweight, they often have less muscle mass to begin with. This puts them at a disadvantage because cancer treatments can lead to muscle breakdown. In fact, some studies show that patients with more muscle mass tend to recover better, have fewer complications, and can even tolerate higher doses of chemotherapy. But for someone who's already underweight, losing muscle can make recovery much harder. Let's talk a little more about chemotherapy. It's one of the most common treatments for cancer, but it can also be one of the hardest on the body. Chemo works by attacking fast-growing cancer cells, but it doesn't stop there. It also targets healthy cells, which leads to some of the harsh side effects like hair loss, nausea, fatigue, and weight loss. For underweight patients, these side effects hit even harder. They don't have the same energy reserves as someone with more body fat or muscle, so they become more susceptible to severe fatigue, muscle wasting, and even infections. This is partly because chemo weakens the immune system, and without enough nutrition and strength to support recovery, the body is left vulnerable. In fact, research shows that underweight patients often experience more intense side effects from chemotherapy than their overweight counterparts. The lack of muscle mass and fat, which can act as a buffer, leaves them with fewer resources to fight back. The immune system plays a key role in fighting off both cancer and infections. Cancer treatments, such as chemotherapy and radiation, weaken the immune system. For someone who's underweight, the immune system is already at a disadvantage due to poor nutrition. This combination makes it harder for their body to fend off secondary infections or complications that can arise during cancer treatment. Overweight patients, on the other hand, sometimes have more robust immune responses during treatments. Their bodies have extra reserves of energy and nutrients to support immune function and healing. Again, this doesn't mean being overweight is ideal, but in terms of surviving aggressive cancer treatments, it can provide an advantage. So, what can underweight cancer patients do to improve their chances of surviving and recovering from treatment? One of the most important things is focusing on nutrition. Meeting with a dietitian who specializes in oncology can help patients create a high-calorie, high-protein diet that supports muscle retention and energy levels, even when they don't feel like eating much. Patients can incorporate calorie-dense foods like healthy fats, lean proteins, and supplements like protein shakes to help maintain their weight and muscle mass. Sometimes, specialized nutrition drinks are recommended by doctors to ensure the body is getting the nutrients it needs, even if eating solid food is difficult. Exercise is another crucial factor. While it might seem counterintuitive, staying physically active, within reason, can help maintain muscle mass and boost energy levels. Light resistance exercises, stretching, or even just a short daily walk can improve strength, reduce fatigue, and enhance overall well-being. Exercise also helps stimulate appetite, which is important for getting enough calories during treatment. While being underweight during cancer treatment can lead to more challenges, the good news is that there are steps patients can take to improve their outcomes. Focusing on proper nutrition, maintaining muscle mass, and staying physically active can make a significant difference. And remember, every person's journey with cancer is different, so it's important to work closely with a healthcare team to create a plan that's right for you.